Congenital heart disease (CHD) refers to a range of structural heart defects present at birth. These defects can affect the heart's walls, valves, blood vessels, or other structures. CHD can vary in severity, ranging from simple conditions like small holes in the heart to complex defects that may require surgical intervention. Thanks to advances in medical care, many children with CHD live well into adulthood, though some may experience lifelong challenges. Types of congenital heart disease. Congenital heart defects are classified into different categories based on the part of the heart affected or how the defect impacts blood flow. The main types include 1. Septal defects. Holes in the heart. Atrial septal defect ASD, a hole in the wall septum between the heart's two upper chambers atria, allowing oxygen-rich blood to mix with oxygen-poor blood. Ventricular septal defect VSD, a hole between the heart's two lower chambers ventricles causing similar mixing of blood. VSDs are among the most common congenital heart defects. 2. Obstructive defects. Narrowing of heart valves or vessels. Pulmonary stenosis. Narrowing of the pulmonary valve, restricting blood flow from the right ventricle to the lungs. Aortic stenosis. Narrowing of the aortic valve, making it harder for the heart to pump blood to the body. Coarctation of the aorta. Narrowing of a portion of the aorta, the major artery that carries blood from the heart to the rest of the body. 3. Cyanotic defects. Reduced oxygen levels in the blood. Tetralogy of Fallot, the combination of 4 defects that result in oxygen-poor blood being pumped out to the body, leading to a bluish skin color. Cyanosis. Transposition of the great arteries. The condition where the two main arteries, the pulmonary artery and aorta, are switched, causing improper circulation of oxygenated and deoxygenated blood. 4. Valve defects. Tricuspid atresia, a defect where the tricuspid valve is absent, preventing normal blood flow from the right atrium to the right ventricle. Ebstein's anomaly, a defect affecting the tricuspid valve, leading to improper blood flow. 5. Single ventricle defects. Conditions like hypoplastic left heart syndrome involve underdevelopment of one of the heart's ventricles, often leading to severe issues with blood circulation. Symptoms. The signs and symptoms of congenital heart disease vary depending on the type and severity of the defect. Some defects may cause no noticeable symptoms in early life, while others are apparent immediately after birth. Common symptoms in infants and children include bluish tint to the skin, lips, and fingernails. Cyanosis due to low oxygen levels. Rapid breathing or difficulty breathing. Poor feeding or failure to thrive, not gaining weight or growing at a normal rate. Fatigue during feeding or activity. Heart murmurs, an abnormal sound heard during a heartbeat. Swelling in the legs, abdomen, or areas around the eyes. In less severe cases, symptoms may not appear until later in childhood or adulthood and can include shortness of breath, particularly during exercise, fatigue or fainting, irregular heart rhythms, arrhythmias, chest pain. Causes and risk factors. Congenital heart disease occurs when the heart or blood vessels near the heart don't develop properly during fetal development. The exact cause of most congenital heart defects is unknown, but certain risk factors can increase the likelihood. Genetic factors. Some congenital heart defects are linked to genetic conditions, such as Down syndrome or Turner syndrome. Maternal factors: poor health during pregnancy, such as infections e.g., rubella, diabetes, or use of alcohol, drugs, or certain medications, can increase the risk of CHD. Family history: having a parent or sibling with CHD increases the likelihood of congenital heart defects. Environmental factors: exposure to harmful substances during pregnancy, like tobacco smoke or pollutants, may also play a role. Diagnosis: congenital heart defects can be detected before birth, shortly after birth, or later in life depending on the severity and symptoms. Diagnostic methods include prenatal ultrasound. Some congenital heart defects can be detected during pregnancy with specialized imaging like fetal echocardiography, which visualizes the developing heart. Physical examination: doctors may detect a heart murmur or signs of cyanosis during a physical exam of the baby. Echocardiogram: a key tool for diagnosing CHD. This ultrasound test uses sound waves to create detailed images of the heart's structure and function. Electrocardiogram (ECG) measures the heart's electrical activity to detect irregularities in rhythm or heart function. Chest X-ray can help visualize the size and shape of the heart and detect any abnormalities. Cardiac MRI or CT scan provides detailed images of the heart and blood vessels. Cardiac catheterization involves inserting a thin tube into the heart via blood vessels to gather detailed information about blood flow and pressure within the heart. Treatment for congenital heart disease depends on the type and severity of the defect. Options may include medications. Medications may be used to help the heart function more effectively, reduce symptoms, and prevent complications. Common medications include diuretics, help reduce fluid buildup and improve heart efficiency. Beta blockers or ACE inhibitors manage blood pressure and heart strain. Anticoagulants prevent blood clots. Catheter-based procedures. Minimally invasive procedures can be used to repair certain defects, such as closing holes in the heart e.g., ASD or VSD, or widening narrow valves or arteries. Surgery. Some defects may require open heart surgery to correct structural issues, such as valve replacement, repair of major blood vessels, or the correction of complex defects like tetralogy of Fallot. In severe cases, babies may require multiple surgeries over time to fully correct the issue. Heart transplant. For severe defects that cannot be repaired, such as hypoplastic left heart syndrome, a heart transplant may be necessary. Long-term outlook and management. Thanks to advances in treatment, most people with congenital heart disease survive into adulthood, though many may require ongoing care. Depending on the type of defect and treatment received, some patients may experience arrhythmias, irregular heartbeats, heart failure, infective endocarditis, the bacterial infection of the heart lining, need for additional surgeries in adulthood. Lifelong follow-up care with a cardiologist is essential for monitoring heart function and managing any complications. Many people with CHD can lead full, active lives, though some may face limitations in strenuous physical activities. Prevention. While congenital heart disease cannot always be prevented, Certain steps may help reduce the risk. Pre-pregnancy planning. Women with pre-existing conditions, like diabetes, should work with their healthcare provider to manage their condition before becoming pregnant. Vaccinations. Receiving the rubella vaccine before pregnancy can help prevent infections that may lead to CHD. Prenatal care. Regular checkups and taking prenatal vitamins, particularly those containing folic acid, can support healthy fetal development. Avoid harmful substances. Pregnant women should avoid alcohol, smoking, and certain medications that may increase the risk of congenital defects. Conclusion: congenital heart disease encompasses a wide range of heart defects present from birth. With early diagnosis and appropriate medical care, most individuals with CHD can lead long and fulfilling lives, although lifelong management may be required. Advances in pediatric cardiology have greatly improved survival and quality of life for people with even the most complex heart defects.